Available treatments for breast cancer. Hearing the words breast cancer can be frightening, but it's important to know that there are many treatment options available today that offer hope and improved outcomes. The good news is that breast cancer is a very treatable cancer, and the cure rate is very high. Stay with us till the end of this video. Below are the available treatment regimens and the possible sequence of treatment. The treatment adopted is usually dependent on the stage of the cancer, the type of cancer, and the wish of the patient. 1. Surgery. The commonest treatment for breast cancer is surgery. This could involve just removal of the tumor and the surrounding tissue called lumpectomy, or removal of the whole breast called mastectomy and the nodes in the armpit. The decision to do which of the two operations depends on the size of the tumor, the location of the tumor, and the involvement or not of the lymph nodes in the corresponding armpit. The decision also depends on the choice of the patient for cosmetic reasons. 2. Radiotherapy. This involves the use of X-rays to kill the cancer cells. It follows removal of the tumor in the breast, but may not follow the removal of the whole breast if there has been no spread to the nodes in the armpit. The course of radiotherapy can last up to 3 to 6 weeks. It is associated with manageable side effects, such as skin changes, swelling or tenderness around the treatment site, change in the size and shape of the breast, fatigue, and mild pain. 3. Hormone therapy. Most forms of breast cancer depend on the female hormones such as estrogen and progesterone for growth. Consequently, disrupting the activities of these hormones puts a stop to the growth of the cancer cells. Breast cancer cells are said to have receptor points, namely estrogen receptors and progesterone receptors, to which the hormone estrogen gets attached to promote growth of cancer cells. These hormones are produced in the body. Hormone therapy therefore involves blocking the production of the hormones by the body or preventing the hormones from getting attached to the receptor points of the cancer cells. Drugs have been developed to achieve this. In some cases of breast cancer, the ovaries can be removed or suppressed to stop or reduce production of estrogen and progesterone. 4. Chemotherapy. Chemotherapy involves the use of medications to kill dividing or rapidly growing cancer cells. It does not stop the growth of cancer cells, it kills cancer cells. Many medicines are available for this purpose. The decision to use chemotherapy or not depends on several factors, including the age of patient, fitness of the patient, size of the tumor, spread of the cancer, grade of the cancer, among others. The side effects of chemotherapy are several, ranging from hair loss, low blood level, bleeding from the skin to low resistance to infections. 5. Biologic therapy. Apart from hormone receptors on cancer cells, some of them may have growth factors called HER receptors. There are 4 of such HER receptors, such as HER 1002, 3, and 4. The most important of these is the HER2. About 15 to 20% of all breast cancers has HER2 receptors, and thus relies on HER2 for growth. Medications have been developed from living organisms such as cells, tissues, or the extracted proteins to prevent the attachment of HER2 to HER2 receptors, and thus prevent growth of the cancer cells. This prevention leads to shrinking and death of the cancer cells. 6. Sequence of treatment. Treatment usually starts with surgery, followed by radiotherapy and then medication treatment to kill any cancer cells in other parts of the body. However, this sequence is not cast in stone. Sometimes chemotherapy follows or precedes surgery, which takes place before radiotherapy. In conclusion, while a breast cancer diagnosis can feel overwhelming, it is important to remember that many effective treatment options are available today. Stay informed, stay alive. If this was helpful, kindly subscribe, comment, like, and share to someone that needs this. See you in our next video.